You're listening to the Good Morning Hamilton podcast from 900 CHML.
Important topic in the province of Ontario, really around the world, and most notably in our neck of the woods as well, and that is healthcare. And along with that is mental health and physician shortages and wait times. And, well, the list goes on and on and on. Here to talk about it is Dr. Richard Tytus. He is the chair of the local Ontario Medical Association district. Dr. Tytus, good morning. How are you today?
Good. Really good. We're all dealing with the challenges that we're currently facing, but otherwise good.
So as we know, this June the 2nd, Ontarians are going to be going to the polls to vote in the latest provincial election, and there's physicians across this province that are saying, listen, there's a number of important topics and issues that we need to discuss that are based around the healthcare system, most notably wait times, mental health, and doctor shortages. Where do you want to start, and what's maybe the most important thing, and how do they all kind of intertwine as well?
Well, we did a survey in 2021, and it was a survey of physicians, healthcare providers, Ontarians, and they said, what are those top issues that we need to address? And the top issues that everyone can agree upon is healthcare, and we have to improve our healthcare, even though there will be a short-term economic impact. So the focus needs to be healthcare, and an average is just not good enough when it comes to the healthcare of our patients, and specifically the healthcare of people in Ontario. And we're talking about the wait times. When it comes to knee surgery, for example, the average wait time for knee surgery is between 42 and 182 days. But in the Hamilton region, it's 33 to 45% longer. Is that good enough?
Yeah, many people, especially those who are on the wait list, are saying no, and clearly the pandemic hasn't helped matters at all. In fact, it has really worsened things because of, hospitals and healthcare settings that had to really pivot massively during the last couple of years. What's been the ripple effect?
Well, the ripple effect is if the entire healthcare system, if we ramped it up to 120%, it would still take us 31 months to catch up. And we're talking about the pandemic effect. What about the regular wait times? And now, as you know, Rick, we're entering the sixth wave of COVID. Now, we haven't even factored that into the equation.
Yeah, and at the end of the day, the wait times aren't going to correct themselves. So there's some massive investment that needs to happen, right?
Absolutely. And one of the solutions that we've considered and we're proposing at the Ontario Medical Association is an integrated ambulatory center. This would take the pressure off the hospitals. And there's a lot of procedures that could be done there. And for example, like knee surgery, hip surgery, cataracts, endoscopies, colonoscopies. And this would remove the pressure from the hospitals, and the hospitals could do other procedures that would be more complicated.
Our guest on Good Morning Hamilton on 900 CHML is Dr. Rick Tytus, chair of the local Ontario Medical Association district, also named the 2012 Family Physician of the Year by the Ontario College of Physicians. Mental health has really been the focal point, not only during the pandemic, certainly before, but also as we are now, as you mentioned, entering the sixth wave of COVID. A number of political parties, whether it's the NDP, the Conservatives in Ontario, the Green Party, all out and making a specific point of highlighting their mental health care plan. Is it nice to see that politicians are paying a lot more attention to this?
Yeah, mental health is a major issue. It's always been a major issue. Access to mental health has always been an issue, but with the pandemic, has really accelerated, and there needs to be a greater focus. I think we'll find that post-pandemic, we'll have more need for mental health, and one of the areas which we find promising is the use of virtual medicine. And with virtual medicine, patients can access mental health in the comfort of their own home, where they're more comfortable and they don't have that angst of having to get to the doctor or the ability or the concerns of going out in the public or taking 3 buses. So again, mental health needs to be addressed, and we need more resources. And I think virtual medicine will be an opportunity to be used to address mental health moving forward.
Absolutely so. Dr. Tytus, thank you very much for your time today. Good luck in pushing this big snowball up the hill, if you will. I know there's a lot of hard work that goes behind it, but it's people like you and others with the OMA and healthcare facilities around the province who are hoping for bigger and better things, and let's hope that is realized sometime down the road.
Yeah, thank you, Rick. And this is, again, an opportunity. Our politicians are listening now, and it's important that we voice our concerns. So thank you very much, and have a great and safe day.
Thank you, and you too, Dr. Rick Tytus, chair of the local Ontario Medical Association District 4, which is the district in our region. Also, as I mentioned, the Family Physician of the Year back in 2012 is voted by the Ontario College of Physicians.
You're listening to the Good Morning Hamilton podcast.